Good evening on this beautiful Saturday evening. I am Dr. Aviral Roy. I am standing in for Dr. Alok Roy, who unfortunately could not make this event today. We have with us Dr. Tanmay Banerjee. Dr. Tanmay Banerjee is a senior consultant in the Department of Critical Care and Internal Medicine at Medica Super Specialty Hospitals. As I'm sure a lot of you are well aware, Dr. Tanmay Banerjee is one of the leading figures in internal medicine and critical care in the city of Kolkata and in fact in the country of India. Today we are going to talk about something that is already upon some of us if they live in northern Bengal. Monsoons are about to hit Calcutta soon, probably in the next 3 to 4 days. Our topic today is going to be monsoon maladies or monsoon related maladies, common diseases that we see in the monsoon season, and what you can do to prevent yourself from getting ill, but also if you are unfortunate to get ill, common things that we can do to take better care of ourselves. Without further ado, I'll hand the mic over to Dr. Banerjee to take the session forward. Dr. Banerjee, please.
Thank you, Dr. Aviral. Actually, a lot of us like the monsoon season because it is coming after a long, hot and humid summer. But we have to keep in mind that monsoon brings with it a lot of new diseases as well. And the risk of catching a disease, viral or bacterial, is almost twice as compared to any other disease during the year. That is because of humid climate, heavy rains, as well as waterlogging, and a lot of contamination in the environment because of rain and waterlogging. So you have to keep in mind that we can have different kind of diseases during the monsoon season. Most commonly and most widely in form of epidemic, what we have seen in last few years or decades is actually the mosquito-borne diseases. What happens in during monsoon is that there are a lot of waterlogging even in the urban cities, domestic waterlogging, just outside or very near to our house, in the buildings, in the urban areas, as well as waterlogging because of blocked drains and pipes. So it can obviously cause a lot of increase in mosquito-borne diseases. We'll come to them one by one because it's very important to know about them. Now, obviously, other problem is with water contamination, as I was talking about. So contaminated water and lack of safe drinking water, as well as contamination of food and beverages, can cause water and foodborne diseases like acute diarrheal diseases and hepatitis and jaundice. Mainly hepatitis A and E, they are carried by the water. Also, this hot and humid climate, being wet in the rain, then coming and it's sitting inside the air conditioning, and lot of overcrowding, sometimes indoors because of the rain, and in the vehicles, in the sort of public transport, can also cause increase in acute respiratory problems like viral infections, flu, and other kind of chest infections. Also to keep in mind that moist and humid weather, wet clothes can cause increase in skin diseases and especially fungal infection of the skin. Another group of diseases, there are other various diseases which can cause sort of problems during the monsoon season and more prevalent during the monsoon, like typhoid fever. That is also again waterborne. Leptospirosis, that's one important one. It spreads by rodent urine, and other illness like scrub typhus fevers, like it happens with the bite of ticks or insects. So, I mean, the mosquito-borne diseases are the most common one. We know probably the names. We know all of us. We know the names. Dengue is most the most common and the dreaded one. Then there are Chikungunya Fever, to the malaria outbreaks. The two types of malaria we see, like Vivax malaria, which is previously called benign malaria, but it is not benign anymore. It can cause problems. And also Falciparum malaria or the Malaria malaria. So coming to dengue fever, I think last 2-3 years, 2 years probably, we have been fortunate not to have an outbreak of very severe outbreak of dengue along with the COVID pandemic, because then it would have been a disaster. Still, we have had cases of dengue coming in, even in COVID patients. We have seen both patients having COVID as well as dengue. So usually dengue fever can happen in our part of the world during the all through the year, but most commonly the epidemic situation happens or arises during the monsoon or just after the monsoon season. It can happen with the late monsoon as well as early monsoon, but usually we see from July to September, October, there is a peak. In India, it has been there for a long time. First, it was reported in Madras, now Chennai in 19th century. In Calcutta, first reported in 1960s. And every 2 to 3 years, we see an increase in dengue outbreak. Sort of, 1 year will be probably with serious number of cases. The next year will be followed by a huge outbreak and increased number of cases. That happens around the world, as we can see, most tropical countries, tropical diseases where rainfall is abundant and the hot and humid conditions are there. So the dengue virus has the 4 types, type 1, 2, 3, and 4, and that is the reason we see a rise in numbers every alternate year or every few years, because not every time the same dengue virus is actually circulating in that particular area, particular city. Same dengue virus can be here, say, for 4 years back, again is coming back, but because immunity is coming down, or 2 kind of different virus may be actually circulating all together in the same city, or maybe a different virus in Mumbai or Delhi and a different virus in Calcutta, that we have seen happening quite commonly, quite frequent. So it's transmitted by Aedes aegypti. That is what we call aircraft mosquito. It's a big one, and it's a daytime mosquito which usually bites during the early hours of the morning or during late afternoon. Also uncommon in our part, but it can be spread by Aedes albopictus. To keep in mind that Aedes can spread also Chikungunya and Zika virus other than dengue, and it has got special characteristics, not like other mosquitoes which spreads malaria infection. It is, as I say, mainly day biting. It bites you during daytime, takes or catches us unaware of. It lives in the small pots of fresh water around the house. So it's an urban mosquito. And it can lay eggs potentially in small jars, even discarded containers, coconut shells, old tires. That's all around our home or our sort of buildings in a city. And it can breed all through the year, but most commonly during the monsoon, because there is water collection during that time. I'll come to dengue actually in a bit more detail, because that is the most important and dreaded infection that can happen during the monsoon season. And as we sort of anticipate that, with the monsoon, the numbers can increase, the government is also taking steps to make public more aware of the infection, increase the public awareness about dengue again, because probably we have forgotten a bit last 2-3 years because we've been busy with COVID. Our minds sort of all been sort of thinking about COVID only. So I think it's very important to again revisit the dengue, because it can actually cause can come in big numbers, maybe sometime during this monsoon season anticipated. that last 2 years has been low. So what we have seen in cycles that every 2 to 3 years it has a massive outbreak. So this year we can be, and our population can be vulnerable to dengue infection. So coming to other kind of mosquito-borne infections, Chikungunya fever is not that as common as dengue in our part of the world, but we have seen cases where dengue is negative. We are thinking that is a viral fever, that lot of body ache, skin rash, especially over the face, there's fatigue, joint pains, and then we are not finding anything else. It's probably worth checking for chikungunya because it can cause a sort of a similar kind of illness like dengue, but not as severe as dengue infection. It's usually self-limiting. You need to see your doctor to have a diagnosis, to have a blood test, then mainly rest and conservative management for pain and fever. Obviously, we know malaria has been there for a long time, and we know that 2 kinds of malaria and their treatment is different. So we need to diagnose the patients early, and it can be done by malaria slide test or better by dual antigen test. So there are 2 kinds of malaria infections, can be Vivax or can be Falciparum. But to keep in mind that anti-malarial or malaria drugs that we have been using, the actual malaria parasite is getting resistant to it, or there's a lot of reported resistance to common anti-malarial drugs we use. So it's very important to be under supervision and not to take it lightly, because malaria can actually land up you in trouble, any patient in trouble, causing renal failure, respiratory problems, breathing difficulties, landing in ventilators, in ICU, and also other complications like low blood hemoglobin and neurological problems, what we call cerebral malaria that we see in Falciparum. So for just to be everyone to be aware of, we need to consider very carefully that it is not that difficult to actually try to prevent. It needs community action, needs a sort of cooperated sort of effort from everyone in the community, but can be controlled with sort of care if we take care of our surroundings, especially the potential mosquito breeding grounds, where we have to be vigilant about small collections of water, even clear water, which can be a breeding ground for Aedes aegypti causing dengue infection. So it can be anything. It can be even a flower pot with water, sort of a, as I said, small sort of container, any sort of discarded plastic container that we sort of find around in our surrounding our houses and surrounding our sort of buildings. So that is very important. I mean, it is not only the sort of role that we have to take up ourselves. We have to make the community aware. Obviously, the municipal corporation has to be there helping everyone, and helping with mosquito control. But we have to be aware ourselves as well. So how dengue is transmitted is that the mosquito, the vector, the Aedes aegypti mosquito that bites an infected person, and then sort of there is a time period for 8 to 10 days where the virus propagates inside the mosquito. Then again, if it bites a healthy person, then it can transmit the dengue virus to that person. And that incubation period is 4 to 10 days. So once you're bitten by a mosquito, Aedes aegypti mosquito carrying dengue virus, anyone who's exposed to that virus may develop fever and symptoms of dengue within 4 to 10 days of mosquito bite, what we call as incubation period. So the infected patients are the most important carriers or transmitters of the virus, and that is being carried out by the vector, the mosquito Aedes aegypti. And usually, if someone has got dengue infection, they will be infected for 2 to 7 days of their infection. So same time around the time they are having high fever or the dengue symptoms. So that is the period they will be sort of infective to spread the virus through the mosquito vector. So any patient with dengue fever, there may be asymptomatic infection, but usually they present with fever. It can be just like a common viral fever, like undifferentiated fever, or classic dengue fever, which is called breaking bone fever, which has got a lot of associated body pain, rash, vomiting, maybe associated abdominal pain, and sort of other complications may happen uh, in patients who are sort of more sick, like dengue hemorrhagic fever, who have low platelets, have bleedings, or dengue shock syndrome, who has low blood pressure. These are serious problems, dengue hemorrhagic fever and dengue shock syndrome. Usually, they land up in ICUs, and there may be a significant morbidity and mortality. Patients may die, and the death rate is quite high there in dengue shock syndrome. So you have to be we have to be careful, and we have to be able to diagnose early. We have to keep the patients hydrated as we give fluids, lot of fluids when the patients come with dengue fever before they have got complications, develop complications. So it's not clear cut always. So be careful. I mean, sort of in the monsoon time, we are having fever. Anyone having fever can be a respiratory infection, can be a viral fever, can be dengue, can be a malaria. So sometimes clinical symptoms will tell you that it could be like very severe body ache. There is rash. The doctor can be clinically suspecting dengue fever, but sometimes it is very difficult to diagnose unless you test, because it just can be just a fever and nothing else. So it's best to see your doctor, best to sort of go to your doctor or to nearest healthcare center and get yourself tested during the high time of dengue season. So as we sort of know that first it starts with fever and initially headache, body ache, and red eyes, sort of all kind of symptoms of acute viral illness. Then it can be followed by a convalescent stage or maybe a toxic stage. Patients who recover go through a convalescent stage, they get better, but some proportion of patients may develop complications or shock or bleeding or low platelet count. So that doesn't happen during the first 3-4 days usually. It happens during the second half of the illness or latter half of the illness, between 4th or 5th to 7th to 8th days. And then if patient is sort of taken care of, they usually recover by 10th day unless there are other complications which are developing in the patients. So if we are suspecting a dengue during the high season or during the epidemic time of dengue, especially monsoon time, we need to do tests. Especially we need to test for blood counts, we need to do the platelet counts, we need to check the clotting if we suspect dengue, and obviously for confirmation we need NS1, that ELISA test we need, on the CUR test, and also after 5 days of illness we can do IgM and IgG antibodies to confirm dengue. And then we can also check for urine to see if there is any complications like protein leak. But most importantly, blood counts, platelet counts, and the dengue NS1 antigen test, or after 5 days, the antibodies, especially the IgM antibodies. So there is no definitive treatment for dengue. There is no antiviral, but mostly supportive. Obviously, prevention is better than cure. But if anyone is having fever suspecting of dengue, don't take aspirin or sort of painkillers like Voveran or diclofenac like that. You can safely take paracetamol, take plenty of fluid and water, keep yourself hydrated. Be especially careful for elderly and small children. And shouldn't need any antibiotics. That doesn't help in dengue. So mainly hydration. If you're at home, drink plenty of water. If you're in hospital, you'll be given IV fluids or saline. And obviously, if anyone is having low blood pressure, having complications, they need hospitalization and they need prompt ICU care. So dose for any patient at home, yes, you can take paracetamol up to 4 grams per day for adults. It can be taken sponging and fans can be used to bring down the temperature or the fever. And any infected patient should be sort of under the mosquito net during the daytime because they can spread infections in the community if they're bitten by the Aedes mosquitoes. Don't, as I said, don't take NSAIDs like painkiller type, aspirin type, or brufen kind of drugs. Antibiotics are not needed usually. And if you're symptomatic, if the patient is not well, don't wait and see medical help. If you're at home, obviously you are taking rest. Adequate bed rest is important. Take plenty of fluid. Take a lot of healthy vegetables and fruits. Those can help in with their antioxidant property. And there's some sort of saying that they can help with platelet count, especially, I mean, there's no proven medical sort of data about that, but having lots of fruits and vegetables and fluids helps. So there is no vaccine for dengue, but obviously we can protect ourselves by preventing ourselves from mosquito bite and preventing the environment from mosquito breeding by working with the community and working with the authorities. So mosquito control is important, as we discussed. Be vigilant, and it's a joint effort of the community and authorities, and we have to contribute ourselves as well. If you're at home and you're in a very mosquito infested area, dengue infested area, keep yourself under a mosquito screen is useful, or using mosquito net. So that's about dengue, but obviously there are other problems during the monsoon season as well, and those happens every year. They're not like dengue that there will be sort of epidemic kind of proportion, but everyone might get it. They're vulnerable to get it if they don't take precautions. So mostly the next common one would be, or maybe a more common one would be a waterborne or foodborne infection. So mostly it is spread by drinking contaminated water or contaminated food. So which is not sort of boiled, sterilized, or carrying bugs. Cholera is very uncommon nowadays in our part of the world, but it used to be in the past a very deadly disease because it can cause dehydration and death very quickly. But at the same time, not to ignore other diarrheal diseases because they can also cause problems. They can also cause dehydration if not taken care properly. So, I mean, anyone having diarrhea, loose motion during this monsoon season, obviously be careful. You have to maintain hydration. If you're staying at home, drink plenty of ORS. Initially, if it is not coming under control, maybe sort of after taking the ORS, if you feel that still persisting and dehydration is setting in, then you need to come to hospital. You need to see your doctor. Next common one, infection, in terms of bacterial infection that we see during this monsoon season is typhoid. So again, typhoid spreads by contaminated food or contaminated through drinking contaminated water. Symptoms are usually prolonged fever, which is not coming down, and patients may present with fever for 1 to 2 weeks or more, associated with abdominal pain, constipation, headaches. If untreated, typhoid can be dangerous, can be sort of dreadful, but there are proper antibiotics and proper treatment for typhoid. So, at diagnosis and treatment, proper treatment is important. Typhoid is diagnosed by sort of blood tests mainly, doing the blood cultures, the antibody tests, and if you're diagnosed with typhoid fever, you need to take antibiotic for a certain period of time as prescribed by your doctor. Next one, which can be spread by sort of contaminated water, especially the monsoon time, is hepatitis causing jaundice, especially the hepatitis A and hepatitis B. So hepatitis A is a virus which you get by drinking contaminated water, same as hepatitis E. Sorry, not B, it's a typo. Hepatitis E. A and E virus, they get transmitted through contaminated water. Along with hepatitis, there are other infections that can be spread by either a virus or other bacterial infections, causing food poisoning, vomiting, um, gastroenteritis, and diarrhea, as we discussed. Also, there are some uncommon diseases like leptospirosis and scrub typhus, which are more common during the monsoon season because of contamination in the environment, as well as sort of the actual humid and rainy environment, bringing in sort of more rodents, which spreads leptospirosis, and also scrub typhus is spread by bugs. So common remedies, I mean, I would probably say the prevention is better than cure. So if you're vigilant, once you have diarrhea, obviously, you have to take ORS, you have to seek medical help, you have to keep yourself hydrated. But you can prevent it by drinking, making sure that you drink clean and filtered and safe water. If you're unsure about the water quality at your home, you can boil it for sufficient time. Better to consume fresh homemade food and washing hands before eating any food. So we have to keep in mind that our hands can be contaminated with bugs and bacteria, and we should wash our hand and clean before we eat any food. Like the same way we have been suggesting and advising for COVID stopping spread of COVID infection, but we keep in mind hand sanitizer may not be enough in this sort of situation. So washing with soap and water is important. And to avoid contact with water or soil contaminated with animal urine or animal sort of bodies, dead animals, especially flooded water, because that can spread disease. Keep yourself and your surroundings clean, and take care of waste and garbage, which can spread infections and disease in the environment. So that is what prevention is better than cure. And if we are all vigilant, we may be able to avoid being infected with all these sort of infections, hepatitis A, E, typhoid, cholera type infections, other sort of waterborne infections. We make sure that we wash our hands properly, we drink safe water, and we avoid eating sort of out, especially uncooked or contaminated food, or sort of unsafe in an unsafe situation. Coming to skin diseases, obviously hot and humid weather outside and indoor can cause increase in fungal infections, increase in dandruff, and also acne and other bacterial infections, cellulitis, boils, ringworms, especially those areas like underarms, boils, which are sort of usually moist by nature, are sort of more common to, are more prone to have this sort of fungal infections. So keeping a sort of dry and maintaining hygiene is important to prevent this skin infections, and also keeping the skin healthy and using sort of, if dry skin can also happen during in patients who has a sort of tendency to have dry skin, that can cause breaking of the skin. So that can also happen in monsoon season. So keep your skin healthy, and if your skin is dry, you should use moisturizer, proper moisturizers. Then obviously the other common one, as we have seen, that during the winter time as well as during the monsoon season, we see more patients with respiratory infection, with chest infections. These are mostly the common flu, or the influenza, or what we call common cold. As common cold virus or influenza virus is actually endemic in the community, and this kind of viral infections are usually self-limiting. You have fever, you have a bit of cough and cold, and you take some sort of home remedies or take paracetamol, keep yourself hydrated. Most people will get better. But to keep in mind, if there is any respiratory distress, if there is any persistent of symptoms like fever, cough, and breathing difficulties, patients with comorbidities like cardiac conditions, kidney problems, liver problems, chronic lung problems, they can develop complications. They should seek help early. And sort of, there are certain variants of flu virus like swine flu, which can have more risk of complications. So usually self-limiting, but if the symptoms are persisting of or someone has got comorbidities, other health problems, should seek medical help and get tested. I put in a question mark for COVID because obviously COVID has been all year around for last 2 years. Whether this monsoon or this year will have COVID outbreak or not, and what sort of uh, so dimension will be that outbreak, and that kind of wave, what we've been calling third, fourth wave. We are still not very sure, but the COVID infection is slowly increasing, though hospitalization other than comorbid patients has not increased because thanks to everyone taking vaccines. But then we have to keep in mind that those vaccines that we have taken in 2021, the effects may be going slowly waning off from our sort of immunity or our body. So we have to keep in mind that if advised or if eligible, everyone should take a booster dose. And then there are lot of other kind of respiratory viruses that can cause infections during the monsoon time, especially in children. RSV, respiratory syncytial virus, other kind of respiratory infections. They're more common in children and can happen in elderly population as well. Then we have seen that we get more allergies and allergic rhinitis, asthma attacks, as well as sort of chest infections, which may not be sort of chest cough or chest symptoms, rather not infections, which may not be infection at all, which may not be viral infection, which can be just allergic, and that is more common due to moist and humid conditions. Also, wet clothes being hanging around inside the sort of indoor area can cause sort of fungal contamination. Fungal spores can cause problems with allergies and other sort of symptoms like asthma. And we should try to keep our environment inside the house, indoor environment, dry and clean, and avoid moist and humid conditions. So, common remedies to advise for the general population, for everyone listening to this program, is that to control respiratory infections is kind of partly similar kind of advice that we have been giving for COVID, like avoid crowded places that will, and reduce your risk of getting respiratory infections, because this spreads same way as COVID spreads, like the influenza viruses. Keep your home and indoor area well ventilated. It is useful if it's crowded to turn down ACs and open the windows and keep the indoor area ventilated if it's crowded. And also wash hands frequently or sanitize your hands, especially before eating or touching your around your nose or mouth. Especially avoid people who have had symptoms of cough and cold, who may be having influenza, who may be having even having COVID, but any other kind of viral infections. This is very important for people with comorbidities, for patients who are elderly, patients who have got respiratory problems, chronic obstructive pulmonary disease like COPD, or other cardiac heart problems, kidney problems, immune deficiency problems. So they should be extra careful, and we all should try to boost our immunity by eating healthy, by eating fresh foods, and having a lot of vegetables, like routine vitamin supplements like vitamin C, vitamin D. Obviously, those kind of supplements you can take for a short period, but not necessary for sort of healthy young individuals. If you are eating healthy, following a sort of healthy lifestyle, your diet should be enough in giving you antioxidant and vitamins. So the take-home message, just to conclude, obviously Dr. Aviral is there, and we may be happy to take questions and have few more sort of points covered if anyone is having any questions or any sort of queries in their mind. But basically, few important points to keep in mind is that, first of all, protect yourself against those kind of infections that you can get in monsoon. Not that difficult, but you have to be careful. First, protect yourself against mosquitoes by sort of taking preventive action against mosquito bites, both indoors and outdoors, and helping the environment to be clean and mosquito free. Best to avoid outside uncooked or sort of raw food and unsafe water. If you're having diarrhea symptoms, take plenty of fluids and ORS. And in case of any further sort of symptoms, in case of any sort of health issues which sort of are not getting better in 2 or 3 days, you're having high fever, someone having breathing difficulty, someone having severe body ache, someone is having dehydration because of diarrhea, don't wait. Consult your doctor or come to hospital or take medical help. If necessary, get yourself tested and treated, because early treatment and early intervention, early diagnosis can help in preventing a lot of complications. Once complications happen, then obviously things become more complicated, and a prolonged treatment or sort of an adverse outcome may not be available. So treating and diagnosing early, be extra careful in preventing as well as getting treated on time is very important. That will be a take-home message from me, especially during this monsoon time, when we are anticipating that in the next 2-3 months there may be an outbreak of dengue. At the same time, there may be COVID still going around, and other sort of respiratory and waterborne diseases can complicate the situation. So this is year should be extra. We all should be extra careful and take care of ourselves. Thank you.
Perfect, sir. Thank you so much for that very detailed and comprehensive overview on common, maladies or common maladies that are prevalent during this monsoon season. I think it's also important for us to remember, COVID is out there, but there are a lot of these diseases that used to exist like dengue, malaria, that seem to have gone out off our radar. And it's important to remember that these have not gone anywhere; they're still lurking around, and we should be careful of what we eat, what we drink, how we wear clothes, and we should not forget the basics of hygiene and care. Dr. Tanmay Banerjee, I just wanted to ask a question. A lot of us get fevers at this time. A lot of us eat out. We might get a little bit of mild gastroenteritis. We might get a little bit of a mild viral infection. At what point should we become concerned? And, I guess this is the important question, that at what point do we start to suspect, this is not just ordinary gastroenteritis, or this is not just an ordinary fever and could be something worse? what are the danger signals or danger signs that you think our audience should be aware of, so that to bring to the hospital early rather than late?
Yes, I mean that's very important and pertinent question. Actually, I'll take answer it in two parts. First of all, patients with fever. So someone is having fever, if that is very high grade, more than say 100, not coming down with taking paracetamol and having complications or other symptoms associated with, like say breathing difficulty, persistent cough, any blood in the sputum, any sort of mental, especially in elderly or children, any mental clouding of mind, if there is any sort of disorientation, and if there is sort of persistent fever, I mean, sort of not coming down within 2 to 3 days with paracetamol, so you should be careful and you should seek medical help and medical attention, because as I said, dengue fever they tend to develop complications between after the third day, 4 to 7 days, and so on. So same with malaria and all. So first day fever, you may not have problems or complications, but day 3, 4 onwards, you might have might develop other problems. So high fever, persisting fever, which is not coming down, it's not getting better. Any symptoms associated with fever, which is like a danger signal, like as I said, breathing difficulty, clouding of mind, low blood pressure, low pulse pressure, tachycardia, high pulse rate, and any sort of dehydration and associated vomiting, diarrhea with the fever, you should seek immediate medical help. Coming to the more sort of a commoner problem that we all have, especially in Calcutta and this part of the sort of world, is stomach upset or tummy upset. We're having sort of mild diarrhea. We have eaten something outside, or we have sort of uh, eaten at home, but had some symptoms which we think that, okay, I have stomach upset, I've got gastroenteritis. I mean, and the thing is that if it is self-limiting, if the diarrhea is not very severe, like in terms of how many times you have to go, whether you can manage to keep your fluids down, whether it's associated with vomiting or not. So as long as you can drink ORS, drink water and keep your fluids down, not vomiting it out when you're drinking fluids and water and ORS, you can, and your diarrhea is not very severe, it is getting sort of say better over hours, you can wait and stay at home and continue to take ORS and oral hydration at home. But if it is associated with fever, so with dehydration, so with vomiting, so that you are not able to drink enough fluid, and any blood in the stool, any associated pain in the abdomen, and any other complications, like someone is having become very tired, unresponsive, or not able to eat and drink because of dehydration setting in. Be very careful. Should take prompt action. Should take prompt medical opinion, and may need to attend hospital immediately.
Excellent. So thank you so much. I guess another important question is, and we see this very often, a lot of our patients have fluid restriction, whether due to kidney disease or heart disease or liver disease. And I think it is important to understand that, that is good as regular therapy. But when they get sick, when they have diarrhea, maybe that may not be the time to stick to the fluid restriction because they have increased fluid losses. So at times of acute sickness, if you are fluid restricted, you should talk to your doctor or go to your doctor sooner rather than later. And otherwise, you're running a very high risk of acute kidney injury or, acute organ failure. What are your thoughts on that, sir?
Definitely. As we discussed during the talk also, that comorbid conditions, you have to be extra careful, because comorbid conditions may actually make you more vulnerable, make one person more vulnerable to develop complications from any infection. And same with fever and diarrhea, that can cause further complications. Coming to the fluid intake, obviously, when you are having high fever, you are losing fluid from your body. So you're losing water. And especially if it is associated with diarrhea and vomiting, then you are losing a lot of fluid and electrolytes from your body. Now, those patients who have chronic kidney disease or chronic heart failure, or maybe some patients with sort of advanced liver disease, they're on fluid restriction as advised by their doctor on a long-term basis. But then if they get dehydrated, they can develop further complications. So the kidney failure can get worse. The heart failure can end up in having kidney trouble also, heart failure patients, or liver failure patients, if they're dehydrated. So very fine line. I think for them, important to keep in mind that they should consult their doctor early rather than late, and sort of may not receive their fluid for a short time during that period whilst they are waiting for medical help. So if they're having severe diarrhea, severe sort of kind of symptoms of dehydration, should obviously awaiting medical help. They should immediately ask for medical help. But waiting for that, at least some oral fluids should be recommended. But then you have to keep in mind kidney failure patients are at risk of developing high potassium or hyperkalemia. So all kind of fluids or sort of water therapy may not be recommended for them. So it is better to ask for medical help, consult their doctors, or sort of seek medical opinion.
Excellent, sir. Thank you so much. Does our audience have any questions for Dr. Tanmay Banerjee? If you do, please raise your hand in the chat, and I will try to get you on audio. So in the meanwhile, what do you think of monkeypox? Sorry to put you on the spot.
Oh yeah, I mean the monkeypox is obviously after COVID, sort of pandemic is another one which is sort of being very much discussed in the media, discussed in the medical community, and sort of not only in India but across the world, across the globe, and especially sort of in Europe and Africa. So it has been a concern. I think monkeypox is a kind of a small, I would say, small brother of smallpox. Sort of actually, it's not as severe as smallpox, but presentation or sort of kind of skin lesions or skin sort of ulcers they get looks like kind of that. It is spread by usually by contact with tropical. Being in tropical sort of forests or being in touch with the hosts of this virus, which are usually could be rodents, could be the monkeys. So it's a monkey. That's the name where it comes from. But maybe other animals also maybe host to this kind of virus. So people who are traveling to the tropical forests or this kind of areas where there are sort of a lot of cases been reported, you have to be extra careful. So that regarding whether we should worry sitting in Calcutta or sitting in India, I think probably not yet. But international community has been vigilant. There has been sort of lot of discussion, lot of, I mean, at the moment we haven't seen any restriction of international travel yet. But alert. So everyone has been put on high alert for this kind of symptoms, especially who are traveling from this to and fro from these areas. And having said that, man-to-man transmission is rare but can happen, especially if you are in contact with someone who is having monkeypox. You touch the lesions, touch the skin ulcers, then don't wash your hands. Then you touch your nose or touch your face or eat, and sort of, it can get infected. Also, you can get infected through respiratory route if you're in touch with the infected patient for a long time in an indoor environment. So it doesn't spread as easily as COVID, but it is contagious and can spread from man to man. Human to human transmission has been reported. So if that is the situation, then we have to be very careful. We have to be really very vigilant, because so far the numbers of man-to-man transmission has been low, but not unknown.
Excellent, sir. Thank you. So I think, folks, that's what you get to it. Doesn't matter what disease you have, whether you have influenza, whether you have COVID, whether you have gastroenteritis, or whether, it's a smallpox outbreak. Basics are still basics. Make sure, you keep your home surroundings clean. Hygiene is of utmost importance. Wash your hands. If possible, wear a mask. Avoid touching your nose and mouth. Basics are called basics because they never change. It does not matter what condition you have, and keep doing those things. And it does not matter. It could be anything, but you will reduce the risk of even getting the common cold. Dr. Banerjee, thank you so much for your wonderful presentation and your detailed explanations on all questions. Thank you so much to our audience for listening to us. I know it's a beautiful Saturday. You could have been outdoors doing so many fun things. I think there's a storm coming, and it's going to be a really nice, pleasant evening. Thank you for spending and giving us your time and listening to us. Thank you to the Medica Department of IT for hosting the seminar on Facebook and on Zoom. Again, health is the ultimate wealth. For Calcutta, we are present every Saturday, 5:30 to 6:30 p.m. We look forward to seeing you next week with our next topic. And as always, we'll send you a message as to what the next topic will be. Thank you so much. And I hope you all have a good evening and a great weekend. Thank you, sir. Thank you, everyone.
Thank
Good
you.
evening.
Good evening to everyone. Thanks a lot.
Good evening.
Thank you, everyone.